Do you want smoother looking legs without the spider veins? The last time the doctors from the McQuaid Vein Center in Southlake Vein Care were here, they discussed a general overview of vein care symptoms and risk factors. But this morning, we're going to talk about the biggest misconceptions regarding the treatment of spider veins and varicose veins. This morning, I'm being joined with Dr. Mark McQuaid and Dr. Andy Skindeleski. What a last name. Nice to see you both today. This is something that I've been dealing with since I was probably in my teens. So we're going to debunk some myths. And the first one we have for you, Dr. McQuaid, fact or fiction? Spider veins only affect older women.
Thanks for having us today, Alana. And that is not true. As you know, we see patients from their teens up all the way to their 90s. We see men and women. Our average age patient is around 42. Really? So we see all kinds of patients, and most patients who even just have spider veins have something underlying that that's causing it.
And you say it might actually be your genetics.
Right, absolutely. Heredity is probably the #1 factor.
Okay, Mom, thank you. but now we have a solution if this is something that you were dealing with. Our next one, fact or fiction, spider veins are simply a cosmetic issue.
So this is also not true. Almost always when there's a cosmetic issue that brings a patient in, there's something underlying it that's causing it. This patient, you can see, had bulging veins, and we treated the underlying problem, and they did great. So there's almost always something underlying this.
That almost looks painful there on the left side. I'm sure, but they feel so relieved when they come and see you. All right, our next one is for Dr. Skindeleski. Fact or fiction, insurance does not cover vein procedures.
That is actually fiction. Insurance, most of our procedures are covered by most insurance policies. So the only exception really is the visual sclerotherapy, what we do to treat the surface veins, the spider veins. So I guess if you have viewers who are dealing with some kind of combination of leg pain, aching, skin changes, ulcerations, restless legs, itching, burning, cramping, any combination of those, whether or not they have spider or varicose veins, it's worth getting checked out, because odds are that their insurance will cover their procedures. And actually the fall is a great time of year to get this, to start their evaluation. It's kind of a perfect storm. Summer's over, kids are back in school, deductibles are met, and people who get their treatments done in the fall and winter are going to be ready to go by the time the winter's over and the weather gets warm again.
It's a good idea to start looking ahead.
You got to plan ahead. It takes time.
Exactly.
Okay, so the time is now to start putting this on your calendar. Also, fact or fiction, vein procedures are minimally invasive.
That is true. That is a fact. All of our procedures are performed in our office. We use local anesthesia. We use some light sedation if we need it. Not every patient does require it. But all our procedures last under an hour, and the patients are awake talking to us the whole time. They get up off the table, and part of our discharge paperwork, our postoperative instructions are go for a couple walks today, be active. So really there's the minimal amount of downtime after these procedures.
That's close to no downtime. I mean, we have to walk to get our mail, we have to walk around the house, and so that's like zero effort.
Yep.
That's great. Veins and varicose veins can be unsightly, but in some situations, as I mentioned before, can also be very painful. So what a great solution to start taking care of this, looking for next year, but to start that process right now. What other procedures do you offer?
So at McQuaid Vein Care and Southlake Vein Care, we really treat the whole patient. So we have a number of procedures that we do to help them. We use endovenous, meaning inside the vein techniques, to close the veins with heat using laser or radio frequency. We inject a lot of veins using injection sclerosing with tiny needles, either visually or under ultrasound guidance. And there's some other things that we do as well to treat the problem. There's also a new procedure that we do called VenaSeal, which is an adhesive, a medical grade adhesive that we can inject into veins to make them go away.
Curious, whenever you have your patients coming in, what is their go-to? What's the most popular procedure right now?
Well, it depends on what they have, but I would say the majority of patients do require treatment of the underlying problem with either radiofrequency ablation or laser. And again, as VenaSeal gets a bit more recognition as a good alternative, we'll see that pick up speed, I think.
Okay, well, it's not a one-size-fits-all, and so the best thing to do is to give them a call and start that conversation to see what best fits you. The doctors from McQuaid Vein Care can answer everything you need to know about spider veins. Here's the number to give them a call. It's 972-378-5347, and all this information and much more is on their website. It's McQuaidVein.com.